today's topic, we'll be talking about Alzheimer's disease. I am pretty sure a lot of you have heard of this um, disease. Would anybody like to remind us or tell us what this is?
It's a neurodegenerative disease where you lose your memory.
Good.
Yeah. That's Thank you. Okay. All right. Next slide. Okay. Alzheimer's disease is a progressive neurological disorder that causes the brain to shrink. It's called atrophy. Um, and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral, and social skills that affects a person's ability to function independently. Um, that's pretty self-explanatory. Just a person's brain doesn't work properly. He can't remember thinking. He's not sharp anymore. It usually happens when people get older. Approximately 5.8 million people in the US age 65 and older live with Alzheimer's disease. So it's a pretty common thing. Of those, 80% are 75 old and older. Out of the approximately 50 million worldwide with dementia, between 60% and 70% are estimated to have Alzheimer's disease. So it's pretty common. As people get older, a lot of people get diagnosed with Alzheimer's. So it's really linked with age. The early signs of this disease include forgetting recent events or conversations. As the disease progresses, a person with Alzheimer's disease will develop severe memory impairment and lose the ability to carry out everyday tasks. Does anybody know a person with Alzheimer's? I know. I personally know one person.
Fortunately, I don't. I know
Fortunately,
family members of friends. Yeah. Yeah, that's me. Are you guys going to talk about the preventative measures to take during your life to hopefully increase your chance that you will not get Alzheimer's?
Yeah.
Okay.
We'll talk about the risk factors.
All right.
All right. Medication may temporarily improve or slow progression of symptoms. These treatments can sometimes help people with Alzheimer's disease maximize function and maintain independence for a time. So, just like other mental diseases, there's types of treatment that a person with Alzheimer's can do to reduce the symptoms. Different programs and services can help support people with Alzheimer's disease and their caregivers. There is no treatment that cures Alzheimer's disease or alters that disease progresses in the brain. In advanced stages of the disease, complications with severe loss of brain function, such as dehydration, malnutrition, or infection, results in death. So pretty serious. So symptoms. What are the symptoms that? Well, I mean, as we talked about this, memory loss is the key symptom of Alzheimer's disease. So you can have like an old person, you can have a conversation with him, like a 1 hour conversation with him for a day, and then the next day you talk to him, he doesn't remember a single thing from the conversation. That could be one of the symptoms of Alzheimer's disease. Early signs of symptoms include difficulty remembering recent events or conversations. As the disease progresses, memory impairment worsens and other symptoms develop. So it progresses as people get older, and it can have a lot of different symptoms. At first, a person with Alzheimer's disease may be aware of having difficulty remembering things and organizing thoughts. A family member or friend may be more likely to notice how the symptoms worsen. So at first, he can like acknowledge that he doesn't remember a lot of things, but at a certain point, he doesn't even know that he's forgetting all these stuff. Brain changes associated with Alzheimer's disease lead to growing trouble going trouble with. Then next slide. Um, Memory. Everyone has occasional memory lapses, but the memory loss associated with Alzheimer's is persistent and worsens, affects the ability to function at home or at work. So people can forget, and there might be normal misfunctions where people forget and lose some memory. Um, but for Alzheimer's, it's just persistent and it just worsens over time. So there's a difference between um, normal for memory loss and Alzheimer's. People with Alzheimer's may repeat statements and questions over and over again. Um, Forget conversations, appointments, or events, and do not remember them later. So this is one of the ways that it can affect everyday life. Let's say you have a doctor's appointment at a certain day, and then you just forget about it. Or let's say you have an important um, family gathering, and you don't show up. You just don't remember. You just carry on with your normal life. Um, routine, Routinely misplace possessions, often putting them in illogical locations. Get lost in familiar places. Eventually forget the names of family members and everyday objects. So it can be really bad. Having troubles finding the right words to identify objects, express thoughts, or take part in conversations. Next slide. Thinking and reasoning. Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts such as numbers. So, yeah, pretty sad. Multitasking is especially difficult, and it may be challenging to manage finances, balance checkbooks, and pay bills on time. Eventually, a person with Alzheimer's may be unable to recognize and deal with numbers. So, it's that bad. Oh, next slide. Making judgments and decisions. Alzheimer's causes a decline in the ability to make reasonable decisions and judgments in everyday life. So I think that's pretty self. Okay, let's do the example. For example, a person may make poor and uncharacteristic choices in social interactions or wear clothes that are inappropriate for the weather. So maybe it'll be a rainy day and he'll go out with a tank top. That's one of the things that may happen. Um, Another thing that may happen is difficulty to respond effectively to everyday problems, such as food burning on the stove or unexpected driving situation. So you may cook and then you just forget the food and it may burn. Um, Planning and performing familiar tasks. Once routine activities that require sequential steps, such as planning and cooking a meal or playing a favorite game, become a struggle as the disease progresses. Next slide. Okay, changing in personality and behavior. So the brain changes that occur in Alzheimer's can affect moods and behaviors. So there's a lot of other things that can happen due to Alzheimer's. Like there's a lot of side conditions that come with it, such as depression, apathy, social withdrawal, mood swings, distrust in others, irritability and aggressiveness, changes in sleeping habits, wandering, loss of inhibition, delusions, such as believing something has been stolen. So you just become, yeah, self-explanatory. um, Preserved skills. Many important skills are preserved for long periods, even while symptoms worsen. Preserved skills may include reading or listening to books, telling stories, menacing, singing, listening to music, dancing, drawing, and doing crafts. These skills may be preserved longer because they controlled by parts of the brain affected later in the course of the disease. So there's some parts of the brain that still function normally, while other parts of the brain worsen. Um,
You'll go now.
yeah.
Okay, I'll
Um,
continue.
If you are concerned about your memory or other thinking skills, talk to your doctor for a thorough assessment and diagnosis. If you are concerned about thinking skills you observe in a family member or friend, talk about your concerns and ask about going together to a doctor's appointment. What causes the disease? The exact cause of Alzheimer's disease aren't fully understood, but at a basic level, brain proteins fail to function normally, which disrupts the work of brain cells and triggers a series of toxic events. Neurons are damaged, lose connections to each other, and eventually die. Scientists believe that for most people, Alzheimer's disease is caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over time. Less than 1% of the time, Alzheimer's is caused by specific genetic changes that virtually guarantee a person will develop the disease. The damage most often starts in the region of the brain that controls memory, but the process begins years before the first symptoms. The loss of neurons spreads in a somewhat predictable pattern to other regions of the brain. By the late stage of the disease, the brain has shrunk significantly. Researchers trying to understand the cause of Alzheimer's disease are focused on the role of two proteins, plaques, a small distant, typically raised patch or region resulting from local damage or deposition of materials such as a fatty deposit on an artery wall in atherosclerosis, or a site of localized damage of brain tissue for Alzheimer's disease. Beta amyloid as a fragment of a larger protein. When these fragments cluster together, they appear to have a toxic effect on neurons and to disrupt cell-to-cell communication. These clusters form larger deposits called amyloid plaques, which also include other cellular debris. And tangles. Tau proteins play a part in a neuron's internal support and transport system to carry nutrients and other essential materials. In Alzheimer's disease, tau proteins change shape and organize themselves into structures called neurofibrillary tangles. The tangles disrupt the transport system and are toxic to cells. Age is one of the risk factors. Increasing age is the greatest known risk factor for Alzheimer's disease. Alzheimer's is not a part of normal aging, but as you grow older, the likelihood of developing Alzheimer's disease increases. Family history and genetics. Your risk of developing Alzheimer's is somewhat higher if a first-degree relative has the disease. Most genetic mechanisms of Alzheimer's among families remain largely unexplained, and the genetic factors are likely complex. Scientists have identified rare changes in their genes that virtually guarantee a person who inherits one of them will develop Alzheimer's. But these mutations account for less than 1% of people with Alzheimer's disease. Down syndrome. Many people, many people with Down syndrome develop Alzheimer's disease. This is likely related to having 3 copies of chromosome 21 and subsequently 3 copies of a gene for the protein that leads to the creation of beta amyloid. Signs and symptoms of Alzheimer's tend to appear 10 to 20 years earlier in people with Down syndrome than they do for the general population. Down syndrome is a condition in which a person has an extra chromosome. Gender. There appears to be a little difference in risk between men and women, but overall there are more women with the disease because they generally live longer than men. Mild cognitive impairment. Mild cognitive impairment is a decline in memory or other thinking skills that is greater than normal for a person's age, but the decline doesn't prevent a person from functioning in a social or work environment. People who have MCI have a significant risk of developing dementia. When the primary MCI deficit is memory, the condition is more likely to progress in dementia due to Alzheimer's disease. A diagnosis of MCI encourages a greater focus on healthy lifestyle changes, developing strategies to make up for memory loss, and scheduling regular doctor appointments to monitor symptoms. Head trauma. People who've had a severe head trauma have a greater risk of Alzheimer's disease. Several large studies found that in people aged 50 years or older who had a traumatic brain injury, the risk of dementia and Alzheimer's disease increases. The risk increases in people with more severe and multiple TBIs. Some studies indicate that the risk may be greater within the first 6 months to 2 years after the TBI. Air pollution. Human studies have found that air pollution exposure particularly from traffic exhaust and burning wood, is associated with greater dementia risk. Excessive alcohol consumption. Drinking large amounts of alcohol has long been known to cause brain changes. Several large studies and reviews found that alcohol use disorders were linked to an increased risk of dementia. Poor sleep patterns. Research has shown that poor sleep patterns, such as difficulty falling asleep or staying asleep, are associated with an increased risk of Alzheimer's disease. Lifestyle and heart health. Research has shown that the same risk factors associated with heart disease may also increase the risk of Alzheimer's disease. These include lack of exercise, obesity, smoking or exposure to secondhand smoke, high blood pressure, high cholesterol, poorly controlled type 2 diabetes. These factors can all be modified. Therefore, changing lifestyle habits can, to some degree, alter your risk. For example, regular exercise and a healthy low-fat diet rich in fruits and vegetables are associated with a decreased risk of developing Alzheimer's disease. Lifelong learning and social engagement. Studies have found an association between lifelong involvement in mentally and socially stimulating activities and a reduced risk of Alzheimer's disease. Low education levels appear to be a risk factor for Alzheimer's disease. Memory and language loss, impaired judgment, and other cognitive changes caused by Alzheimer's can complicate treatment for other health conditions. A person with Alzheimer's disease may not be able to communicate that he or she is experiencing pain, explain symptoms of another illness, follow a prescribed treatment plan, explain medication side effects. As Alzheimer's disease progresses to its last stages, brain changes begin to affect physical function, such as swallowing, balance, and bowel and bladder control. These effects can increase vulnerability to additional health problems, such as inhaling food or liquid into the lungs, flu, pneumonia, and other functions, falls, fractures, bedstones, malnutrition or dehydration, constipation or diarrhea, dental problems such as mouth sores or tooth decay. There is no prevention for Alzheimer's disease. However, a number of lifestyle risk factors for Alzheimer's can be modified. Evidence suggests that changes in diet, exercise, and habits, steps to reduce the risk of cardiovascular disease, may also lower your risk of developing Alzheimer's disease and other disorders that cause dementia. Heart-healthy lifestyle choices that may reduce the risk of Alzheimer's include the following: exercising regularly, eating a diet of fresh produce, healthy oils, and foods low in saturated fats, such as a Mediterranean diet, following treatment guidelines to manage high blood pressure, diabetes, and high cholesterol, asking your doctor for help to quit smoking if you smoke. Studies have shown that preserved thinking skills later in life and a reduced risk of Alzheimer's disease are associated with participating in social events, reading, dancing, playing board games, creating art, playing an instrument, and other activities that require mental and social engagement. An important part of diagnosing Alzheimer's disease includes being able to explain your symptoms, as well as perspective from a close family member or friend about symptoms and their impact on daily life. A diagnosis of Alzheimer's disease is based on tests your doctor administers to assess memory and thinking skills. Laboratory and imaging tests can rule out other potential causes or help the doctor better identify the disease-causing dementia symptoms. Alzheimer's disease is only diagnosed with complete certainty after death, when microscopic examination of the brain reveals the characteristic plaques and tangles. A diagnostic workup would likely include the following tests: physical and neurological exam. Your doctor will perform a physical exam and likely assess overall neurological health by testing the following: reflexes, muscle tone and strength, ability to get up from a chair and walk across the room, sense of sight and hearing, coordination and balance. Lab tests. Blood tests may help your doctor rule out other potential causes of memory loss and confusion, such as thyroid disorder or vitamin deficiencies. mental status, and neuropsychological testing. Your doctor may give you a brief mental status test to assess memory and other thinking skills. Longer forms of neuropsychological testing may provide additional details about the mental function compared with people of a similar age and education level. These tests can help establish a diagnosis and serve as a starting point to track the progression of symptoms in the future. Brain imaging. Images of the brain are now used chiefly to pinpoint visible abnormalities related to conditions other than Alzheimer's disease, such as strokes, trauma, or tumors, that may cause cognitive change. New imaging applications, currently used primarily in major medical centers or in clinical trials, may enable doctors to detect specific brain changes caused by Alzheimer's. Imaging of brain structures include the following: magnetic resonance imaging, or MRI. MRI used radio waves and a strong magnetic field to produce detailed images of the brain. While they may show brain shrinkage of brain regions associated with Alzheimer's disease, MRI can also rule out other conditions. An MRI is generally preferred to a CT scan for the evaluation of dementia. And there is the computerized tomography, or CT scan. A CT scan, a specialized X-ray technology, produces cross-sectional images of your brain. It's usually used to rule out tumors, strokes, and head injuries. Imaging of disease processes can be performed with positron emission tomography, or PET. During a PET scan, a low-level radioactive tracer is injected into the blood to reveal a particular feature in the brain. PET imaging may include the following: fluorodeoxyglucose. PET scans show areas of the brain in which nutrients are poorly metabolized. Identifying patterns of degeneration, areas of low metabolism can help distinguish between Alzheimer's disease and other types of dementia. Amyloid PET imaging can measure the burden of amyloid deposits in the brain. This imaging is primarily used to research, but may be used if a person has unusual or very early onset of dementia symptoms. Tau PET imaging, which measures the burden of neurofibrillary tangles in the brain. In special circumstances, such as rapidly progressive dementia with atypical features, or early onset dementia, other tests may be used to measure abnormal beta amyloid and tau in the cerebrospinal fluid, which is in your brain. Researchers are working to develop tests that can measure biological signs of disease processes in the brain. These tests, including blood tests, may improve the accuracy of diagnosis and enable earlier diagnosis before the onset of symptoms. Genetic testing generally isn't recommended for a routine Alzheimer's disease evaluation. The exception is people who have a family history of early onset Alzheimer's disease. Meeting with a genetic counselor to discuss the risks and benefits of genetic testing is recommended before undergoing any test. One of the treatments is drugs. Current Alzheimer's medications can help for a time with memory symptoms and other cognitive changes. Two types of drugs are currently used to treat cognitive symptoms: cholinesterase inhibitors. These drugs work by boosting levels of cell-to-cell communication by preserving a chemical messenger that is depleted in the brain by Alzheimer's disease. These are usually the first medications tried, and most people see modest improvements in symptoms. Cholinesterase inhibitors may also improve neuropsychiatric symptoms such as agitation or depression. The main side effects of these drugs include diarrhea, nausea, loss of appetite, and sleep disturbances. In people with certain heart disorders, serious side effects may include cardiac arrhythmia, which refers to a group of conditions that cause the heart to beat irregular, too slow or too quickly, bradycardia or tachycardia. Another type of drugs is memantine. This drug works in another brain cell communication network and slows the progression of symptoms with moderate to severe Alzheimer's disease. It's sometimes used in combination Without strong stress inhibitors, relatively rare side effects include dizziness and confusion. Sometimes other medications, such as antidepressants, may be prescribed to help control the behavioral symptoms associated with Alzheimer's disease. Creating a safe and supportive environment is another treatment. Adapting the living situation to the needs of a person with Alzheimer's disease is an important part of any treatment plan. For someone with Alzheimer's, establishing and strengthening routine habits and minimizing memory demanding tasks can make life much easier. You can take these steps to support a person's sense of well-being and continued ability to function. Always keep keys, wallets, mobile phones, and other valuable in the same place at home, so they don't become lost. Keep medications in a secure location. Use a daily checklist to keep track of dosages. Arrange it for finances to be an automatic payment and automatic deposit. Have the person with Alzheimer's carry a mobile phone with location capability on so that the caregiver can track its location. Program important phone numbers into the phone. Install alarm sensors on doors and windows. Make sure regular appointments are on the same day at the same time as much as possible. Use a calendar or whiteboard in the home to track daily schedules. Build the habit of checking off completed items. Remove excess furniture, clutter, and throw rugs. Install sturdy handrails on stairways and in bathrooms. Ensure that shoes and slippers are comfortable and provide good traction. Reduce the number of mirrors because people with Alzheimer's may find images in mirrors confusing or frightening. Make sure that the person with Alzheimer's carries identifications or wears a medical alert bracelet. Keep photographs and other meaningful objects around the house. Alternative medicines would include various herbal remedies. Vitamins and other supplements are widely promoted as preparations that may support cognitive health or prevent or delay Alzheimer's. Some of the treatments that have been studied recently include vitamin E. Although vitamin E doesn't prevent Alzheimer's, taking 2,000 international units daily may help delay the progression in people who already have mild to moderate disease. Supplements promoted for cognitive health can interact with medications you're taking for Alzheimer's disease or other health conditions. Work closely with your healthcare team to create a safe treatment plan with any prescriptions, over-the-counter medications, or dietary supplements. Omega-3 fatty acids in fish or from supplements may lower the risk of developing dementia, but clinical studies have shown no benefit for treating Alzheimer's disease symptoms. Curcumin, this herb comes from its turmeric and has anti-inflammatory and antioxidant properties that might affect chemical processes in the brain. So far, clinical trials have found no benefit for treating Alzheimer's disease. Ginkgo. Ginkgo is a plant extract containing several medicinal properties. A large study funded by the National Institutes of Health found no effect in preventing or delaying Alzheimer's disease. Melatonin, this supplement of a hormone that regulates sleep, is being studied to determine if it offers benefits managing sleep in people with dementia. But some research has indicated that melatonin may worsen mood in some people with dementia.
It's dementia, just to let you know.
Dementia. Healthy lifestyle choices promote good overall health and may play a role in maintaining a cognitive health. Regular exercise is an important part of a treatment plan. Activities such as a daily walk can help improve mood and maintain the health of joints, muscles, and the heart. Exercise can also promote restful sleep and prevent constipation. People with Alzheimer's who develop trouble walking may still be able to use a stationary bike, stretch with elastic bands, or participate in chair exercises. Nutrition. People with Alzheimer's may forget to eat, lose interest in preparing meals, or not eat a healthy combination of foods. They may also forget to drink enough, leading to dehydration and constipation. offer the following: healthy options, buy favorite healthy foods options that are easy to eat, water and other healthy beverages, encourage drinking several glasses of liquids every day, avoid beverages with caffeine, which can increase restlessness, interfere with sleep, and trigger a frequent need to urinate, high calorie healthy shakes and smoothies, supplement milkshakes with protein powders or mix smoothies featuring favorite ingredients, especially when eating becomes more difficult. Social interaction and activities can support the abilities and skills that are preserved. Doing things that are meaningful and enjoyable are important for the overall well-being of a person with Alzheimer's disease. These might include listening to music or dancing, reading or listening to books, gardening or crafts, social events at a senior or memory care centers, planned activities with children. People with Alzheimer's disease experience a mixture of emotions: confusion, frustration, anger, fear, uncertainty, grief, and depression. If you're caring for someone with Alzheimer's, you can help them cope with the disease by being there to listen, reassuring the person that life can still be enjoyed, providing support, and doing your best to help the people retain dignity and self respect. A calm and stable home environment can help reduce behavior problems. In new situations, noise, large groups of people being rushed or pressed to remember, or being asked to do complicated tasks can cause anxiety. As a person with Alzheimer's becomes upset, the ability to think clearly declines even more. Caring for a person with Alzheimer's disease is physically and emotionally demanding. Feelings of anger and guilt, stress and discouragement, worry and grief, and social isolation are common. Caregiving can even take a toll on the caregiver's physical health. Paying attention to your own needs and well being is one of the most important things you can do for yourself and for the person with Alzheimer's. If you're a caregiver for someone with Alzheimer's, you can help yourself by learning as much about the disease as you can, asking questions of doctors, social workers, and others involved in the care of your loved one, calling on friends or other family members for help when you need it, taking a break every day, spending time with your friends, taking care of your health by seeing your own doctors on schedule, eating healthy meals and getting exercise, joining a support group, making use of local adult day center if possible. Many people with Alzheimer's and families benefit from counseling or local support services. Contact your local Alzheimer's Association affiliate to connect with people to connect with support groups. Doctors, occupational therapists, resources and referrals, home care agencies, residential care facilities, a telephone helpline, and educational seminars. And that's the end of the presentation. Thanks for your attention.